I'm Rob.
And I'm Mike.
And I'm Mindy.
And welcome to Let's Get Ethical.
All right. Welcome, everybody, to another edition of Let's Get Ethical. Rob, how are you? Mindy, welcome. I should go to Mindy first. Sorry, Rob. That's my bad.
No, go to Mindy first.
Thank you for coming on.
Yes,
again.
thank you.
Yes.
Thank you for having me.
Woo-hoo! This is what our virtual platform looks like. Yeah. So for everybody watching, this one's going to be interesting. Oh, I guess let me start.
Don't forget.
Start with this stuff here, right? If you have a question, you want to email us, you have comments, you have a comment below, 100% subscribe to the podcast. Make sure you're notified so that when these crazy ones come out, you can watch them. If you have other questions you don't want public, let's get ethical podcast at gmail.com. There, I did that stuff.
Thank you. Good work.
So, yeah, I almost forgot again.
You're hired.
Almost. Yeah, I can intern for free. Yeah. So, Mindy reached out to us with and Mindy, I'm gonna have to preface this with you. I'm not on social media. I have accounts. I have an Instagram somewhere. I have a Facebook somewhere. I haven't been on in more than a year. Personally, if you want to reach me, it's got to be on LinkedIn. I don't flood my brain with just the stupidity on Facebook. However, that's the stuff we're here to talk about today. So, Mindy, why don't you tell everybody what you reached out to us regarding?
All right. Well, yeah. So last weekend, I think it was last week it started. We heard about this cruise ship, right?
Yes.
And it had all these people on it. 3 people had died from this virus that was caused from rodent droppings. And the media has really stretched it out of proportion. But I have noticed on social media, because I'm very active, because that's how I promote the APRT, right? It's how I promote respiratory therapy. That on TikTok, there are nurses, there are respiratory therapists, there are physicians, there are pharmacists who are on this platform, a lot of them with their badges on while they're at work, talking about if there was another pandemic, if this hantavirus is pandemic 2.0, I would not work. I would not do it again. I would not take care of my patients. I would just not do it. It's not worth it. And to me, that really got me, just because I personally think, and this is my opinion, as licensed healthcare professionals, it is your ethical duty to take care of patients. Because when you get that license and you're practicing, you kind of signed an oath, especially when you sign up to a hospital to work, that you will care for patients in need, even if it's a pandemic. So a lot of the TikToks, a lot of the posts that I was seeing on social media really got to me as a healthcare professional. So that's kind of why I reached out, because I think it's an important topic that we talk about. What if there's another pandemic?
So let's
Go ahead, Mike. What are you thinking? I see the wheels are turning.
Sure,
baby.
you want to know?
The wheels are turning.
So I've done some research. I know Rob's done some research on this. My good friend Claude and I have been talking about this for about 3 days now. And so there is all kinds of stuff. First of all, let's just squash the hantavirus issue.
Yeah, can we do that first? You're going to put some stats up?
Let's do it. Let's throw this up.
Yeah, let's look at the
hantavirus has been around forever, everybody. This is not something new. It's not surprise there's a hantavirus. It's not COVID, right? It's not COVID, and COVID's a whole other animal that I can complain about also. So I'm gonna get edgy, everybody. These are my opinions. If you disagree, you're welcome to disagree. But if you disagree with me, I need you to bring true, real statistics and not just percentages. I need the numbers also. I'm just telling you. Let's just start with that. All right. I might as well be from Missouri. I require everything to be shown to me and proven to me. In fact, my parents are from Missouri, and that's how I was raised. So let's take a look at the hantavirus. Over 30 years, the hantavirus has killed 309 people. 30 years.
Yeah, 30
Heart
30 years
disease
of data.
killed 2.1 million people in 3 years. That's heart disease. If I'm going to worry about something, it's not going to be Hanta. It's going to be going for a walk so that I can be cardiovascularly healthy. Cancer over the same 3 years killed 1.8 million people. And what's interesting, just so I can be a little jerk about COVID, over those same 3 years that heart disease killed 2.1 and cancer killed 1.8, COVID killed 1.2. We have not shut down the country over heart disease or cancer yet. I don't know why we did it over COVID. That's just my take. I don't know what to tell you guys. I know that a lot of people are going to disagree with that, and that's fine. You're welcome to disagree. But the facts don't lie. And the flu kills about 30,000 people every year.
Yep.
That's every year.
Yeah, correct.
309 hantavirus. Why are we freaking out? I don't know. That's just me. So let's get that out of the way. You guys have anything to say about that?
So what I'd like to do is I just want to make a point about something. So
Sure.
I was in the Navy for a long time. And back in the late 1980s and early 1990s, when I was stationed over in Okinawa, I went on 3 deployments to Korea. And back then, one of the biggest things that we worried about in the medical side was Korean hemorrhagic fever. Do you know what Korean hemorrhagic fever is, Mindy?
I do.
I do not. No.
It's hantavirus. Okay, it's hantavirus. So again, to Mike's point, this is not a new virus. We have had viruses outbreak in the United States of certain variants. This particular variant, this variant down in Argentina, again, is not new. It's not novel. Some interesting things that I learned today. I actually jumped on this really cool. Every month, the folks down at Department of Health and Human Services in the state of New Hampshire, they do a monthly kind of infection prevention, infection control, and they did a big webinar today about hantavirus. And really, to be honest with you, a lot of it was about, let's just dispel all the media nonsense around this virus. Okay. And I'm not picking on bird watchers. I love birds. But if you go and hang out in landfills in South America, because that's where all the birds are, you might get hantavirus. And that's what happened. And I'm going to just tell you from, again, my opinions of my own as well. If it had not been for COVID, I think this would have been a one-time news cycle, and that would have been the end of it. That would have been the end of it. Now, Mindy, I don't know if you're comfortable with this, but there's a screenshot that you sent to me that I think I'd like to put up on the screen that was kind of posted, and I think it was in the Cleveland, Ohio area.
Correct.
If you don't want to throw that up there for just a second, Mike. Okay. So again, and I don't want to make today's conversation necessarily about hantavirus, but here's a little something that I want everybody to understand. This level 3 emergency response, that's the lowest level, lowest. That's the CDC just basically saying, hey, guess what?
Somebody got sick.
Yeah, somebody got sick, right?
Yeah.
Somebody got sick. And hey, we just want everybody to know there's no there with this. We want everybody to take a breath. But that's not the juxtapose of this conversation. Mindy, I want you to kind of go into what is burning your heels right now about this entire thing, because this isn't the issue. Mm-hmm. Let's talk about what the issue is.
To me, the issue is all the social media platforms, all these people on social media, all the news media that are posting these things, which are hyping Americans up, right? And then you get, what really gets me is you get the nurses, and I love my nurses I work with. I think they have a very difficult job. You have our very own respiratory therapist who are coming on and saying, I won't do this again. I was frontline center before. I won't do a 2.0. People are on their own. I've seen physicians, pharmacists, like I said, pharmacists, and it really, really gets to me because if we're not there in a time when our patients really need us, say there was another pandemic, who is going to help these patients, right? I posted under someone because it just really got me. I was like, I was respiratory therapist frontline. We were intubating patients during COVID. Was it awful? Yes. Would I do it again? If I had to, yes, because it's completely unethical for me not to take care of patients when they're in need. And I've been seeing a lot of this. And I think it's worse because they're wearing their work badges. It says where they work, and this is social media. And with the way that nurses and RTs are getting in trouble with posting at work with their badges, that's completely unethical too. I personally think we should ban social media while you're at work. You shouldn't be able to post while you're at work.
Well, I think I think more than that is that look, we're adults. Every single person in that hospital who's working is an adult. I don't care if you're 18. You're an adult. You're in an environment where you have to act appropriately, act accordingly. You are more than welcome to have your opinions. You are more than welcome to post whatever you want. But you have to be careful. I always use Starbucks or McDonald's. If you work at Starbucks or McDonald's and you're posting stuff while you're at work and you're in your Starbucks or McDonald's uniform, what is Starbucks or McDonald's going to do? If they don't agree with you or they don't like you, they are going to fire you.
Fire you. Right.
The hospital's no different. You're representing by default, right? By default, you are in scrubs with the hospital wall behind you, your badge, if it's in view, right? You are representing your facility by happenstance in that moment. If you take your badge off, and I want to be real clear here, if you take your badge off, but you still have your scrubs on and you're sitting in your car in the parking lot, if your hospital sees that, in their mind, you represent them, you're still in your work uniform. You guys settle down. Say what you want. Freedom of speech, that's fine. However, one of my issues with all of that, and this is, while it's ethical, it's just a gripe I have, is that people who post on social media, and I'm making a generalized statement, and I'm going to circle back to the generalized statement in a little bit. It'll come back up regardless, because I have something to say, Mindy, about the person that responded to you, and I have some advice for that person and people like that. And let's be honest, I'm one of those people. Sometimes I hear something and I spew. Right? Okay, it's just what we do as people, but we have to own it. We got to be aware of it.
Right.
But I want to be real clear that when you have a deep belief, there's always going to be somebody that disagrees with you. We understand on this podcast, people are going to disagree with us. We invite it. We actually prefer that disagreement is really what ethics is all about, which is why we need to have them. So if you disagree with me, that's awesome. I so want to hear from you, right? Not because I want to slam you, because we want to have a conversation. It's all about perspective. But what I hate the most, and one of the reasons that I got off social media, is I can't post what I feel, because there's going to be 10 people that are going to jump on that. I have a great example. Yep. Oh my God, this was the funniest thing. I was getting rid of, it was a 40-inch flat screen TV. It wasn't brand new. I was giving it away for free on the Facebook Marketplace. For free. I posted it. I said, hey, maybe some of you have a kid who you need a TV for their room. Here you go. Come pick it up. It's yours. Just come get it. I only had like 2 people that were interested, but I had like 15 posts, maybe 12 posts. I had people saying, there is a recycle center. The appropriate way to recycle that is to do this. And they're leaving me links like I'm going to go look this up. Like I care, right? They're like, oh, here's a great DIY project for your TV to make it look like a fish tank on the wall. I'm trying not to cuss at everybody, right? I don't care. I don't want to do that. I'm trying to give it away to somebody who might need a TV and might not have the money to afford a TV. Here's a free TV. Nobody seemed to care. I got people just trying to bash the idea of me giving it away for free. I had one guy post, was it the TV or something else? It might have been something else I was giving away for free. Somebody posted, if you pay me $100, I'll come pick it up. And I'm like, and I told him on there publicly, I said, look, if you don't want it, that's fine. You can keep scrolling. Why are you wasting your time? Right? This is my problem with social media is people are weird, and not that the screenshots that we're going to get to are weird. It's that people are going to disagree, and that's okay. You can speak your mind. Do it appropriately.
Right.
Do it appropriately at appropriate time and place. If somebody's trying to do something good, don't bash that. If somebody's trying to create awareness, don't bash that. If somebody has something to say, you can disagree respectfully. And this brings us to that reply that you got, Mindy, because it starts with, I respectfully disagree. Now, I appreciate that. I don't know who this person is. We blurted out, but I appreciate that it's, Amen. I respectfully disagree. But then I feel like this response is a pretty, from an ethical standpoint, and I'm trying to remain ethical and not be so me about it, right? This response is a lot of times what we see, right? And this is, I don't know about RT, but tons of nurses have been leaving bedside because of constant abuse, lack of pay, and more. I get that. I understand. I don't. Is this you? Are you a nurse? Did you leave the bedside, or are you just speaking from what you've heard from nurses who still work at your facility who also haven't left the bedside? I don't know where this is coming from. Personally, I prefer show me, right? Show me that kind of stuff, right? And this last statement, nurses aren't professionals anymore, even though we were just heroes a few years ago. This is a problem. This is a problem that we need to address. There's two quoted words here, and we need to address both of them. Profession refers to two things, right? Number one, it's the way that your profession is designed, right? That becomes the definition of a profession. The definition of a profession has to have a length of study, has to have a certification, have to have self-policing, right? And they have to be able to demonstrate a minimum level of competency within that chosen area of study. All of those things come together to form what we consider a, quote, profession. Nursing is a profession.
Absolutely it is.
Our nurses professional.
Yeah.
Not our nurses professionals, our nurses professional. Well, that's from nurse to nurse, just like it's from RT to RT, from respiratory therapist to respiratory therapist. Whether or not you are professional relies solely on you and your attitude towards what you're doing.
Correct.
This is an important thing to understand, right? Patients' families were awful to those on the front lines. I've been in this field for 30 years, and long before COVID, I've been swung on by a patient. Long before COVID, I've been kicked out of a patient's room. Long before COVID, I've had patients and families who were awful to me. This has nothing to do with COVID. This has to do with the fact that we are truly in a thankless profession. We're both nursing and respiratory therapists and physicians.
Healthcare in general.
Healthcare in general. Yes, ma'am.
Yep.
We are in, and I'm going to get off my soapbox in a minute. I swear to God, everybody, I apologize. We are in a thankless profession. If that bothers you, I have complete respect for the fact it bothers you, but maybe this isn't for you.
Maybe this isn't the right profession.
Yeah.
I want, can I speak? Can I talk about hero?
Yes,
the word hero.
Please, for the love of God, cut me off. Thank you.
Oh my God. No. It's okay. You know how we are. So several years ago, I think it was a couple years after we wrapped up the pandemic, and I was listening to, and I want to say it was a podcast, and I can't remember who it was, but this person who was either a psychologist or a psychiatrist, they said we should never have allowed ourselves to call healthcare workers heroes.
Oh yeah.
And the reason for that, this individual said, this lady said, I thought it was brilliant. She said, we put an undue amount of stress on healthcare workers and an expectation that they can't meet. They can't meet it.
Yep.
And she said that we weren't heroes. We were ordinary people who did extraordinary things during those times.
Absolutely.
And that's exactly, and I'll tell you, like, I can't tell you how many pictures I have outside the hospital that I worked at, right? I said, thank you, you're heroes. And, and I never walked out thinking, I'm not a hero. Like, I'm a respiratory therapist. I got to choose my profession,
right?
But I don't get to choose who rolls through the door and when.
100%.
Right.
And that, right. And I also, Mindy, I want to ask you this question, because Mike, we just had this conversation about this the other day. And Mindy, when do you think this ethical line started to blur on social media? Because this isn't the first post that I've seen from healthcare professionals. I see posts in certain respiratory chat rooms on Facebook all the time.
Oh, let's call them out. It's respiratory therapy break room.
It's respiratory therapy break room.
Yeah.
And
I have a bunch of these that I actually use in an ethics lecture that are abhorrent.
You do.
I had to take myself off that one.
Yeah, I'm at the point after I saw one today before, because I just want to grab this point that somebody asked the question of whether or not during a new hire process, you would be drug tested for marijuana. Okay. Somebody replied and said, yes. And if I were you, I would lay off it for a while until you get onboarded. And then I'd be kind of, very casual.
Right, then you're good to go back. Yeah. Yeah.
Okay. I honestly, I'm not going to lie. I typed out, perhaps you should just stop, in capital letters, smoking marijuana completely and think about your profession. And then I erased it. It was one of those, I got it off my chest. I did not hit send. I erased it and I moved on.
That's the best thing to do.
Oh, good for you, man. Good for you. That goes back to our previous podcast, right?
Yes.
If you guys haven't seen it, go watch it. Go look. It's very interesting because it relates to that. And another one was somebody who was on prescription medication at the hospital. And their argument was, but I was prescribed this medication. And it all falls back to your employer is still your boss. And it doesn't matter if you live in Colorado, California, or wherever else marijuana is legal. If your employer says you can't be high, you can't smoke marijuana, then guess what? You can't. Right. It's just the way it works.
Right.
There's really no way around. You can not like it, but again, I would fall back to maybe you need to go work at a smoke shop. I don't know. I don't know what to tell you. That's the thing. And nothing against, I live in California. Marijuana is legal. I don't smoke it. Somebody wants to. Totally cool. Doesn't bother me. I have no problem with it.
Yep. I don't care.
My problem is when you complain about your employer having rules. So that's my issue. It's come on.
Yeah, go ahead. So when do we I've been trying to wrap my head around this because I can't figure it out either. But Mindy, when do you think these ethical lines started to blur? Because people just seem to put whatever they want.
Yeah.
I honestly think it happened during COVID. It really did. That's when social media really changed. Everyone was home. They were bored. Everything was public knowledge. They could speak what they wanted to say. And that's really when I think, especially post-COVID, people, nurses, and respiratory therapists in general become very negative when it comes towards their profession. And they just started posting whatever they felt. And yes, it's okay to speak your mind and give your opinion. But when you're persuading the rest of your profession, and then people comment on that, and it just spirals. And it's just really gotten out of control the last several years. It's to the point where I don't ever post anything personal, really at all, about my family, hardly ever, because I want to keep that to myself. But everyone else is just like they put everything out there. Oh, I got divorced yesterday because I had a baby mama, whatever. And I'm just like, guys, but I really do think this has come from the COVID pandemic.
Yeah. Do you think it's that lack of interaction between people? But I mean, I wasn't sitting at home on Facebook. You weren't sitting at home on Facebook. Mike, you weren't sitting at home on Facebook.
No.
So everybody who worked in this profession at the time, none of you were sitting at home on Facebook.
Right.
So I don't the things that I see posted for people who are supposed to be professionals and have a license and have a profession and who are dutied, right, to provide care, like the things that I see people say, I'm aghast.
Oh, me too.
You're about to get me canceled, and I don't even have a fan base.
We might all get canceled at this
We're all
point.
going to get canceled, yeah.
Because the attitudes, it's all about attitude, right?
Right.
It's all about our attitude towards ourselves and towards the world. We live in a society that is honestly extremely selfish.
Yes.
I can do what I want. I don't care if it offends you, but how dare you just offended me?
Right.
What? What? How does that? I'm sorry. Time out. Right? Let me slap you in the face a little bit. I offended you, and that's not okay, but it's okay for you to offend me. And the answer that you'll get from them is, well, yeah, it's fine. I don't have a problem with.
Right. It's okay for everyone else to speak your mind until you speak up to defend yourself.
Yeah, I don't get that. I don't get that. And my response to that is, let's just start losing friends. Because I don't care. I'm like, oh no. And so what I wound up doing is, because I'm not one to get involved really in those conversations. It's happened a couple times. And then after that, I just stopped posting on Facebook altogether. But then I become like the lurker on Facebook. Why am I on Facebook? I got off Facebook. It didn't make any sense. And I've actually had it in the last year. I accidentally got involved in that same kind of back and forth one time on LinkedIn. And I finally I stopped and I was like, what am I doing? I'm like, do I really care that much? No, I don't. I was trying to help it first. And then it became this back and forth and this, you're wrong. And I'm like, I'm wrong. And I'm like, oh God, no, I did it again. You know what I mean?
It's like this big giant
out of the conversation. I just stopped replying.
Well, it's the same thing. This is why I had to get rid of the respiratory break room. Okay. Because people that don't even understand what the APRT is, right? Back when we first got started, I was first hired, they would put their 2 cents in and post things that they had no idea what was an APRT, actually, what we were doing. Basically, we're just a glorified respiratory therapist, blah, blah, blah. Anyway,
you off, won't it?
I got tired of defending something that we are building to make our profession better. Because I love our profession. I love being a respiratory therapist. I love what I do now because I still bring in those skills. And there's no way that I would ever down talk being an RT. I do believe that burnout was a real thing during the pandemic. And I know people are still burnout. They still complain about burnout. I am one that's never been burned out.
Me either.
I love what I do.
You want to hear some stats about burnout? I have them.
Yeah, actually.
Yeah.
I have some stats on burnout.
Yeah.
I was going to ask you this.
Those, Mike? I don't know. I just happen to know these. Just kidding. They're right over here on this screen.
Bring Claude into the mix, will you?
Yeah, no, for real. So currently, as of 2025, there was a study done in US and Canada, and currently 70% of RTs report being burnout. And the interesting thing is that during COVID, at its peak, the burnout rate was reported at 79%, right? 93% RTs say burnout's a major issue, right? But then we get things, and the reason for them, and this, I have to go back and validate this statement, right? So whoever this was, I'm actually going to validate your statement, because many of the reasons that people give for their burnout are underappreciation, right? Constant abuse, lack of pay, right? Those are the 2 main things that people give as reasons for the burnout that they feel. And I just start thinking to myself, what should you do? Right? What would my advice be to you? You're afraid of another pandemic. And most people most people, what we find when we look at all these studies, I don't know who's doing studies on this, but I can read them. What we find is that people aren't of the opinion really that, hey, if the next pandemic comes, I'm out, right? And it's not, Rob, it's not if, right?
It's not if. It's a matter of when, and that's not
Right.
and that's not coming from me, right? That's
what we find.
That's fact. The fact is there will be another pandemic.
Yeah.
And the World Health Organization, I think it's the World Health Organization that even says it could be worse than what we just saw.
Mhm.
Yeah, but what we find is that when we look at all these studies, what I found is that 25% of, and let's just call it healthcare professionals, it's kind of nurses and RTs together. They're both kind of equal. 25% are ready to leave their position, or leave their organization, or leave the field. And what it is, it's what we state it as though it's another pandemic and I'm gone. And people go, well, that's rude. And Mindy, that was your thing, right?
Yeah.
And that's why I looked this up. Your thing was, how dare you? Another pandemic comes, you need to care for those patients. And I agree. If you want out, get out now, right?
Right.
Go.
What I found is a couple things. And this is where my advice is going to come in. I'm just very long-winded about it. What I found is that it's not if the next pandemic comes, I'm out. It's that I'm still burnt out from the last pandemic. They never fixed what broke, and we're still dealing with these issues that were never repaired.
Mm-hmm.
And I've got one foot out the door.
Yeah.
Right. And 25% have that one foot out the door. They're ready to leave. They're just looking for the final reason.
Yeah.
And that pandemic would be the final reason to not stay. Right. So the studies lay it out a little bit differently to me, which is interesting. I go, okay, I can kind of understand that. But now here's my advice, everybody. All right. My advice is this. Two things. Number one, C's get degrees. 75% in school is great, but 75% commitment at the bedside is not what I want for me or my family. Right. Is it what you want for you or yours? Do you want somebody who's 25% out the door, caring for you, caring for your life, nurse or RT, doesn't matter? Is that what you want? It's not what I want. If you're looking for one final reason, that's fine. If that's going to be the straw that broke the camel's back and you're going to leave, that's fine. However, you need to prepare, right? You need to be prepared to leave. If you know you've got one foot out the door and if another pandemic comes, you're out. We've just told you another pandemic's going to come, everybody. It's going to happen. Why it's not cancer or heart disease, I have no idea. I really don't know, because let's face it, heart disease kills more people every 3 hours than the hantavirus has killed in 30 years, people.
Amen.
Right? It's not going to be the hantavirus. And if the hantavirus comes, we're going to be good, because there has never in the United States been a documented case of hanta that was person to person. So don't play with your cat's poop and you're going to be fine.
It's not
if
your
I
cat,
can be
really.
a little sarcastic about it. You know what I mean? I'm just joking, right? It's always been direct exposure to rodents and or their feces. That's what it's always been, right? It's never been human to human. Now, this recent one is a one-off, because I think there have been 3 cases that have been proven to be human to human, but that hasn't been in the United States.
Correct.
And everybody's now off that cruise ship. And so those people are all just being watched now, and they got to be watched for the next, how long is the incubation period, Rob? I forget.
It's
like
30, is it 30 days? I think it's 30 days.
Yeah. And you can develop symptoms up to 8 weeks, 8 weeks out.
So 1 to 2 months, something like that.
1 to 2 months.
Yeah.
And
but those people are being watched. They've been aware. We know what's going on. So, and there have been human to human cases. In the past, not in the United States. And in the United States, hanta cases that have occurred in the United States. Hold on, I actually have that number somewhere. I won't go crazy trying to find it. If it doesn't just pop up, it doesn't hit me in the face, I won't keep going. It's not hitting me in the face. Minimal PPE is all that people have been used. And in the United States, there's never been a case where a healthcare worker got Hanta from caring for a Hanta patient, because it hasn't been a human-to-human contact or human-to-human transmission.
Right.
So we're going to be okay there, right? But I get what it does is it raises the concern. And you guys got to cut me off. I'm just going to keep talking.
No, so I think, Mike, part of, and I'd love to hear Mindy's thought on this is, I think what COVID brought out in all of us was a lack of understanding or appreciation that healthcare workers suffer moral distress.
Mm-hmm.
And that moral distress was there before COVID happened.
It was.
And it wasn't addressed. And then we went into COVID. It was sort of talked about, but it wasn't really addressed. It's still not being addressed. Moral distress among healthcare workers is still not being appropriately, let me use the word appropriately, because the appropriate word appropriate is doing a lot there.
I have a really quick question before you go on.
Yes, sir.
This is for both of you, because I honestly don't know. I don't feel like I don't remember it as a label before COVID. Was moral distress a label before COVID, or before COVID it existed, but we just didn't have a name for it? Do you guys know?
I don't think that my generation, like our generation, had labeled it.
No.
I think probably back when there was tuberculosis and the plague back in those days, those nurses probably went through what we went through during COVID.
Right.
But they went to another pandemic not too long later, right? And we still have nurses. So I don't think it's this generation.
I don't think it was either. I don't recall before COVID the word. I don't recall ever before the word COVID hearing the word moral distress.
Right. Exactly.
And I know that, and again, we went through COVID, and right after that we had the worst RSV outbreak that we had seen ever in our careers. I also think that, again, generationally, as far as generation wise and where we are in our profession, we were all kind of brought up in healthcare of bad things happen. This is the job you chose. Move on after it happens. I don't prescribe to that philosophy anymore. I do think that terrible things happen to humans. And I think that we as frontline providers of healthcare, as respiratory therapists, we do see some awful things. And I always tell respiratory students, you will work in the hospital long enough. If you work in the hospital long enough, a child will come in the ER and you will not be able to save them no matter what you do. And that is going to cause you a great deal of pain and suffering, and it's going to upset you. And it's okay to cry. It's okay to feel 100%. Bad.
Right.
And it's okay to tell your supervisor, I need 10 minutes to go collect myself.
Yeah.
And we're going to let you do that. We're going to give you the 10 or 15 minutes you need to go do whatever you need to do. Cry, pray, get a cup of coffee, whatever you need to do. It's okay, because we are humans and we have emotions, and we do suffer compassion fatigue, and we do suffer moral distress.
Right.
We're not doing enough. The healthcare community, I think, is still not doing enough. I'm going to tie this into a little bit of is the shift of ethical decision-making part of this moral distress, that maybe people don't really have an output, and they go on Facebook and they think that it's a safe space and they can just espouse whatever they want, despite the fact that their name is there, or their kids' picture's there, or their picture's there. And people just jump on the bandwagon. Like Mike and I were talking about earlier, that it's the 2% of people that complain the most, right? It's not the 98%.
Right.
They have the loudest voices. Yeah.
Right. It's the 2% that scream the loudest, and they get the most attention. Mindy, what do you think of everything that I just this big giant circle that I just went around in?
Oh, I agree with you 100%. There's always those ones that just have to let their voice be heard, because they're the ones that always complain. They always complain. They always want to bring up the issue. I will tell you, most of my emotional distress from healthcare did not come during the pandemic. It came with other incidences like traumas, traumatic intubations, codes going bad. That to me is what gets me the most. The pandemic did not did not do that to me. I think it's because I don't know if I prepared myself for a pandemic one day, but I knew one day we'd be taking care of lots of sick people. So it didn't bother me, but I agree with you 100%. I really do.
Mike, what are your thoughts? What do you think, Mike? What are your thoughts?
So I'd like to go back to just finish up what I was saying at one point. We got away from it because I was getting on my soapbox, but I do feel I need to finish the thought, and that's with regards to the 25% foot out the door.
Mm-hmm.
What, another pandemic comes, you need to be prepared. If there are hundreds, maybe more than hundreds of trades, respiratory is a trade, nursing is a trade, right? These are trade professions. There are hundreds of trades that will support your family, that don't have to deal with pandemics, that you can prepare to do now if you want to leave, right? We often worry about the workforce, and we've been worrying about it honestly since like 2005. In my mind, since 2005, in the next 5 or 10 years, 30% are gone. And then 2008 hit, and then 2012, and then the pandemic, and now nobody's gone yet, right? Right. And so now it's 2030. Now it's 2030. Right. Said that's the date now. When back in 2005, the date was 2010. So I don't know when it's actually going to happen. Mm-hmm. But that's just kind of, it's coming, sure. But if your attitude is, and this isn't a negative thing, right? If your attitude isn't toward patient care, if it's away from patient care, that's fine. I respect that. But does that mean you stay in patient care and just complain all the time about it? Or does that mean that you actually step up and do something about it so that you're happy in your life? Mm-hmm. I say step up and do something about it so that you're happy in your life. We have, and I looked this up also today, we have somewhere between 5,000 and 7,000 new grads every year who are looking for jobs. Mm-hmm. There's somebody who would be 100% committed rather than 75% committed at that bedside.
Yep.
I'd rather have that person take care of my family, and I think you would too.
Right.
Even if you're one of those 25% with your foot out the door, I think if you were in the hospital, you'd rather have somebody who's 100% in rather than 25% out the door taking care of you. And that's fair. And you can be 25% out the door and still feel that way about being in there, right? That's not being disrespectful or rude. I think, though, rather than continue to just espouse it on Facebook, how unhappy you are, or on social media, let me say, Facebook, TikTok, Instagram, whatever other grams there are, Exchangegram. Exchangegram, that's a internship. Whatever other grams there are, rather than putting it there, go be happy.
Yeah. Find something that fits you and that you're going to be happy doing. Yep. One of the things I learned during the it was more after the pandemic was, the respiratory therapists who were burnout, and I'm not disagreeing that they were burnout, but the negativity that they had towards being a respiratory therapist after COVID trickled down to our students. Yep. And our students would not get a good clinical rotation, and it's taken time to build that back up.
Because those are our students' preceptors. Yeah.
Right. Yep. So, the preceptors were bedside RTs, and a lot of them just didn't want to do it. They didn't want to have somebody tag along with them because they were so burnt out and exhausted from COVID that they didn't want to do it anymore. And
I had students that came back and told me they were asked, why are you doing this?
Right. And that has really hurt. That really hurt a lot of our students. Like, our students are like, I don't know if I want to do this anymore. That's why I became a clinical preceptor where I worked, because I saw that. And I was like, no. I can't have these students who have this bright future getting it destroyed because one of my fellow respiratory therapists is like, why didn't you go into nursing, or why are you in healthcare in general? It sucks. And that was the attitude. It is getting better. I have seen it getting better, but there's a generation of these students who are traumatized from clinical rotation going into the work field. And that definitely needs to change.
Yeah. And sadly, negativity is so much easier than positivity.
Mhm.
Negative
100%.
indoctrination, which is what that is. Negative indoctrination catches on so much more quickly than positive indoctrination, right? And not that indoctrination is the best thing. So let me take my ethics hat off and put my psychology hat on, because I all of a sudden have a degree that I paid $25 for online in psychology. No, I don't. But psychologically speaking, it's easier to indoctrinate negative thoughts
Mhm.
about anything than it is to indoctrinate about positive thoughts. Positive
Yes.
reinforcement is so much more important. And so this is to all of you who are practicing and are preceptors and have students. Keep that in mind when you have that student. Even if you feel negatively about the profession, do not transfer that to the
Please.
student. Allow that student to have their own experience, because it may be positive, it may be negative, but let them have their own experience. Don't push your experience on them, especially if it's negative,
Mhm.
right? Let them have that own experience. And I would say, even if negative or positive, don't put your stuff on the student. Let the student experience. The student's not there to deal with your problems.
Right.
Right. They're there to learn.
Yeah, the student's there to learn. Let them learn, right? Keep that stuff away from the students, right? And this happens mostly, it doesn't happen with the therapist and the student at the bedside, where the therapist is going, hey, you know what? This profession sucks. You should get out. What the hell are you doing? You're crazy. That's not where it happens. It happens when they're in the break room and the
Correct.
student's there too, and they're talking amongst their peers. We need to remember that there's a student there. We
Yep.
need to remember that there's somebody there who is not from this environment. If it's me, Mindy, Rob, and we're in there, you can talk your negative thoughts. We have our own experiences to draw from. The student doesn't have those. The student's going to draw from your experiences, and your experiences are going to determine their attitude. And that's what happened, Mindy. And that's not okay.
No, it's not okay. And then it also brings the morale down of your
100%.
department.
Yes.
And there's a lot of departments who are still suffering from
Yeah.
COVID, and we don't need to scare about another pandemic when we know it'll happen someday, but it's not going to be the hantavirus.
Nope. Nope.
So-
Sorry, ABC News.
Hanta 2.0 is not coming.
And
All
let
right.
me follow up that news comment with,
Sorry, I shouldn't have said that.
no, you just opened the door. Here it comes. Full cancellation right now. When it does happen, when the pandemic does happen, I do want all of you to remember this graphic.
Mhm.
And I want you to ask, is this bigger than cancer? Is it bigger than heart disease? And why aren't we so focused on those? Why are we having a pandemic about this? H1N1 was bad.
Mhm. It was bad.
Yes, it was.
It
Yes,
was
it
was really bad.
it didn't catch the media attention like COVID.
No, it didn't.
Why? And my
Are you-
answer, wait,
Yep.
I have an answer,
Oh.
and you guys are going to love this. It's all political,
Yes.
right
I
or
agree.
left. I don't care if it's Bush, Clinton, Obama, Trump, Biden, Harris, doesn't matter. It's political, 100%.
And
It's
I've heard
absolutely, what's that?
I've heard those too. I've heard because it's
Yeah.
midterm elections and
Oh, yeah.
Trump is in office, there's going to be another pandemic
Oh yeah,
because
sure.
Republicans are causing it, and
Yeah.
or whatever. And I'm just
Whatever
like,
it is, it's gonna be political. And
mhm.
unless it's bigger than heart disease and cancer, to me, it's not pandemic worthy. We have so much more things to worry about.
Mhm.
And there's a whole path I can go down on COVID.
No,
right?
but that data, Mike, doesn't lie. Like that data does not lie. That's factual right there. We have bigger problems in our healthcare system to worry about. People need to come to the bedside with the right attitude. You come into your profession with the right attitude. You demonstrate professionalism. You act ethically. You don't create a toxic, negative environment. Like all these things we talked about today are the meat and potatoes, of today's discussion.
Right.
Whoa.
Well, I tell you, looking at that chart there, the two top number one killers over the last couple of years, heart disease and cancer, stems from cigarettes. Cigarettes is a pandemic. People smoking is a pandemic. That causes heart disease. It causes cancer. If a respiratory therapist would really step up, and I on my soapbox about this, and we do our job like we really, really can, and we do smoking cessation, we do that education with our patients, we can help decrease those numbers.
Yep.
So I was listening to Joe Rogan the other day.
We're going to give Joe. We're going to give you a little nod here.
I was listening to Joe Rogan. I'm not even going to tell anybody the episode or because he referenced a YouTube channel. He referenced a couple doctors, but there's a couple doctors and there's a couple studies out there, Mindy, that actually disagree with that statement, and it trips me out. I don't want to get into it because I'm not educated on it enough to really have a real conversation, but there are some doctors, I guess it's cardiologists and cardiovascular surgeons that are starting to disagree with that whole statement. Now, from a lung standpoint, you can't argue it, but they're starting to say that I don't want to misstate this. So if I'm wrong, my bad. It's something along the lines of smoking along with the right diet is okay.
No.
So does that head back to the 1950s commercials?
Something like that.
Right. Does that go back to the 1950s black and white commercials to say more doctors smoke Camels than any other brand cigarettes in America?
That is insane to me, because there is so much research that shows that smoking causes so many diseases, disorders across the board.
I'll link to it and you can watch it. And I didn't go search it out, but I'll find it and I'll email you a link to it and you can watch it. And then you can educate me. I'll listen to you 100%. I'm not going to go watch it and find out for myself. I just think it's, because I still agree with you 100%. I just think it's funny that there are any physicians there are any studies that show something different. And I don't know enough about it to have an educated conversation. I mean,
once you're a smoker, your lungs are crap, right? You can't breathe. It stresses your heart out. You end up with congestive heart failure. You can end up with pulmonary hypertension. The list goes on and on and on. Right. And the plaque from smoking and the tar helps with your hyperlipidemia, which can cause those clogged arteries. So I would disagree with that 100%.
Apparently, so if you took good. I don't know.
Right? If you took that graph and you took COVID out of there, COPD is still the third leading cause of death. Right? If you took that COVID time frame out of that time period, and Mindy, correct me if I'm wrong. You are the expert on this. COPD is still the third leading cause of death.
Yep, I do believe that is correct. Yes.
Yes, it's fourth now after COVID, right?
Yeah, after COVID. But if you took those COVID numbers out there, I bet COPD would be right up still as number 3 and number 4.
I agree with that.
Yeah.
And then, not all smokers end up with COPD. They could have other things that cause it, alpha-1, that kind of stuff. So, but we can prevent some of this. We can't really prevent another pandemic, but we can prevent these 2 leading causes of death in the United States.
Oh, you know what we can do with the next pandemic? Oh man, I thought I got away from this. I thought I wasn't gonna say this. Is if you guys have watched this far, and hopefully you have, because this is extremely important. 94% of COVID-related deaths had comorbidities.
Yes,
and 100,000 patients a year die from uncontrolled heart, blood pressure, diabetes, things like that. And these aren't patients who can't afford. These are 100,000 patients who have insurance, who have the medication. They're just non-compliant.
Correct.
Which means, and only, I wasn't going to say this either, but here I go. Only 6% of the COVID-related deaths over those 3 years had COVID only, right? Now, that's not to say that COVID didn't kill any of the other 94%, but many of those with comorbidities, they were uncontrolled, unregulated. They were non-compliant. In our system, we need to educate as well. We need to focus on that. Right. We need to focus more on that. And because if we did, and if somebody listens to this and goes, hey, you know what, I better go take my insulin, fine, do it. Because well-controlled comorbidities, when that pandemic hits, have better outcomes with regards to the pandemic. So who knows how many of those, it was something like how many 100,000 deaths from COVID? How many 100,000 deaths?
Put it back up.
Did it have the number? 1.2 million deaths.
1.2 million. Yeah.
But how many of them? So 6% of those were COVID only.
Yeah.
Right. So what's 6% of that? So is that 60,000? Let's say
60,000, give or take.
60,000, give or take. The rest of them had comorbidities, and of those 100,000 right there, I don't know if they could have been saved. And Claude warned me about saying that. He warned me not to say that. but I feel like, those with comorbidities, if you're fearing another pandemic, get on your comorbidity. Make sure that you're caring for that. Make sure that you're doing whatever rehab needs to be done, whatever medications need to be done, whatever you need to live your best ADL, your best activities of daily life now, so that when that happens, you're not more susceptible than everybody else because you're uncontrolled comorbidity. I think that's a fair statement.
That's a fair statement, Mike. That's an excellent positive way. Mindy, this was a big one, and I want to thank you so much for coming on today. Since Mike ended it on a positive note, what's your positive message today to all our listeners?
Love what you do. So if you know that healthcare is not your passion anymore, find something that is your passion so you can be healthy, you can be happy, and you don't need to feel like you have to come to work every day to something that you only want to give 75% to.
Hallelujah. That is an amen.
Absolutely,
Thank you.
100%.
That is so great. All right. So I'm going to wrap it up with today. And I want to, Mike.
Mindy, make sure you
Mindy.
hang out after we're done. We forgot to tell our last guest. Hang out after we're done.
So with that being said, I want to thank Mike, my co-host, and Mindy, thank you again. Right, for joining us, the Taylor Swift of advanced practice respiratory therapists. We love her for that. So everybody, thank you so much for today, and join us next time on Let's Get Ethical.